Hello, I'm Ricky Tucker, and I'll be your moderator today. We'd like to thank you for joining us. We have an outstanding panel that we'll be talking to today. First of all, we have Mrs. Estella Mayhew Greer. She's the president and CEO of the Mid-South Area Food Bank. Welcome, Mrs. Greer.
Thank you.
We also have Mr. James Luvene. He's a pastor, a social and community advocate, as well as a former business owner. Ms. Luvene, Pastor Luvene, welcome.
Thank you.
And then we have Mr. Kendall Kohlheim. Mr. Kohlheim is also a pastor, and he is an affordable health care professional. Mr. Pastor Kohlheim, welcome.
Thank you.
All right, we're going to be talking today about healthcare issues, feeding the hungry and the food insecure population, as well as some economic development. And with that, Pastor Luvene, we'd like to ask you if you would really get us started here today.
Thank you, first of all, Ricky, for having us. I called Brother Ricky some weeks ago to ask if I could be a part of his program. This is a project that I'm doing in conjunction with the United Methodist Church, in particular for a class that I'm a part of with Wesley Theological Seminary in Washington, D.C. The class is made up of clergy from across the Tennessee and the Memphis Conference, was selected by our bishop in conjunction with leaders in the church. Our responsibility, and the reason that I wanted to be on this stage today, was to prepare a presentation that I have to make in about 2 weeks for my class. And we wanted to talk about some of the teachings of the social principles of the United Methodist Church. Miss Estella and I have been working on a project there in Dyersburg in West Tennessee of trying to make sure that we create security for food for families. Ricky and I go way back. We've been working when I was in my previous life in the business world. I met Ricky and Gwen. But today we want to talk about the Methodist Church and some of the things that we're trying to do. And I wanted to have this panel to help me talk about how can the church play a role in dealing with some of the social and economic challenges facing our nation, but in particular to the poor. And that's kind of the backdrop that I want to set here, is that we're talking about how do we respond to the needs of the poor or those living on the margins in our country. So I want to kind of start off by just talking a little bit about some things that I've been involved in. In particular, I've been really involved in the health care debate. I've been concerned about health care since 1979. And that was because that's when I started my career with the Social Security Administration. And I realized when I was working with the Social Security Administration that more and more people were coming into my office looking for health care benefits, for disability benefits. But what I began to realize after some years in that job, that most of the people that were applying for disability were applying for benefits for things that were treatable and things that could have been resolved had they had health care access. In other words, people were not going to the doctor. They were not getting the health care they needed because they couldn't afford it. And then years later, they were coming in for disability benefits for things that were so treatable. And that began to bother me, I must admit. It bothered me greatly when I saw people that if they had been taking their medicine 20 years ago, affordable medicine, they probably wouldn't have been disabled. And so that began to register. And then I began to see some other things. It's kind of like we'd say sometimes, people travel in packs or trouble travels in packs. And I began to notice there was a correlation a lot of times between not having health care and not having financial stability. So they seemed to be like, they ran in the same neighborhood all the time. And now, of course, having been in business and now being a United Methodist minister, I serve 3 high at-risk communities, one in Alamo, Tennessee, one in Tigard, Tennessee, and one in Dyersburg, Tennessee. My churches serve more as social agencies sometimes than they do as churches, because we're always dealing with people's problems. Most of those problems are of the financial nature, not being able to pay their utilities, not being able to pay their rent, not being able to afford health care. And so when I was selected for this became, I guess, one of my priorities is how do we get this message out? The Methodist Church, and I'm proud to say this, has had a long history of social justice, justice for the poor, helping the poor to come out of poverty. But we've done that not just by ourselves. We've been very successful over the years of partnering with other agencies, other nonprofits, and even other churches. And so that's kind of where the backdrop for this is to talk about how do we work together to collaborate. Estella and I were talking before we started this taping, and one of the things we were talking about was when churches can understand the things that they could allow other people to do, that they can do better than what churches can do. I've been impressed with what they do in feeding the hungry. Our churches can't do that.
Right.
But we can sure support them when they come to us and say, we need your support. We do that with other agencies, with Workers Interfaith Network. Churches are not equipped to deal with a lot of the social issues, dealing with wage laws and things. But we can sure work with those organizations that are on the front line every day. So part of the church's responsibility, I do believe, and I think the Methodist Church believes this, is that we are our brothers and our sisters' keepers.
Absolutely. Well, that's a really great backdrop, and thank you very much, because we wanted to build a foundation first. And you talked about the illnesses that a number of people who are destitute end up showing up in the hospitals and in the doctor's offices. But we know that there's a core reason for that, and we really would like to hear from Mrs. Greer, because she sees the core reason for the health issues, and it's primarily related to food or the lack thereof. So, Ms. Greer, thank you for joining us and bringing your expertise and your knowledge and wisdom. Would you share some things with us that from your profession and your years of feeding the homeless, and I can't thank you enough for the work that you and your organization does year after year and day after day. So would you just share some information with us, please?
Well, I think one thing that we need to really differentiate between is the poor and people who are food insecure. The federal government has guidelines for poverty, but when you look at people who are facing food insecurity throughout this country, then you're only looking at 59% of the population that is in poverty. Now, this is nationwide, and the rest are food insecure. They may fall slightly above the poverty level, but they're struggling to make ends meet. And one of the things that we realize at food banks as a part of the Feeding America network of food banks is that people make tough choices between food. And when you have limited resources, food is what's often left off the table. You talked about health care. Well, I've got a choice between getting my prescription filled or eating. I'm going to get the prescription filled. But what's the purpose if you're not eating properly? We conducted a hunger survey last year, and we found that 33% of the households here in the Mid-South had someone who had diabetes. That's 33% of the households that we provide food to had someone with diabetes in that household. That goes back to not having the proper diet. We also discovered that 60% of the households that rely on us for food had someone in that household with high blood pressure. So food insecurity ties into poor health. And we see it over and over again with our seniors who are on a fixed income. They're going to limit what they're eating so that they can get their prescriptions filled. We see that over and over again. People are making tough choices in the winter months. Am I going to heat or am I going to eat? In the summer months, when it's scorching hot outside and they're trying to determine, do I pay my utility bills or do I feed my children who are out of school and who are missing those meals because they're out of school? So what we do as food banks is collaborate with organizations to make sure that we're meeting the nutritional needs of those people who are facing food insecurity. So I'm pleased to say that here in the Mid-South, that 80% of our partner agencies are faith-based organizations who are helping us. We are a food distribution center, and we focus in 4 areas: basically feeding children, feeding families, feeding seniors, and education and advocacy, to let people know that hunger, food insecurity goes beyond just not having enough to eat, but its impact. Because if you're worried about how you're going to feed your children, then you're not a productive worker when you report into work, because you're struggling trying to figure out, I've got hungry children at home that I need to feed. When you are worried about how you're going to get to work, and you've got to choose between gas and food, then those are tough choices that are being made. And this is not something that can be solved by one organization or one entity, but through the Feeding America network of food banks, we're proof that collaboration works in addressing the problem, because we couldn't do what we do without collaborating with those other nonprofit organizations and faith-based organizations that help us feed people.
Yes.
And that was just kind of a segue. When Ms. Greer and the Memphis Food Bank came to Dyersburg just a couple of weeks ago to let us know about how we could get our food program back on the table. We had lost our program. And when she told me, I wasn't aware how many people we had been feeding. I mean, it had been in excess over a period of over 1,000 people per month. Mm-hmm. And when I say feed, we're not talking about a Thanksgiving meal. Those are great. And most of our churches are good at that. You know, Thanksgiving Day or the week of Thanksgiving, churches are good at opening our doors and inviting the masses in to eat. We see them all over Memphis, we see them in Nashville and everywhere else. But we're talking about feeding people every day. And what the food bank does, they come and they put boxes of food that will feed a family for weeks, not on a holiday. And so that really connected, and for me it was right in our sweet spot as a church.
But I think one of the key things is that the food we provide is nutritious food.
Yes, yes.
We focus on nutrition, and we're distributing more produce, fresh produce, than we ever have in the history of food banking. And this is nationwide, because we understand that fresh produce is an expensive item for people who are struggling to make ends meet. So we're providing that because it's more nutritious. You know, if you have fresh vegetables and fresh fruit, then it's more nutritious than buying canned food that's high in cholesterol and high in salt.
Yes.
You know, so we, even when we purchase those canned items, we're making sure we're purchasing items that are low in sodium, even the canned fruits that are in their own juices, not the syrups, because we do understand the impact that nutrition has on health.
That's where what I talked about earlier is so important, that we see an opportunity here with our ministerial alliance in Dyersburg, not to try to recreate the wheel. These people are good at what they do.
Right.
They're real good. And so what we're trying to do is to come up with a model where the faith-based community says, let's put our resources and our efforts behind this group, and our prayers, obviously, and our funds, to help them do what they do already so well, and not to try to compete with them, as we see in some communities, which I think creates a lot of problems for, and I'll say this because I think this ties into my project that we're talking about. Sometimes churches themselves become problematic because churches sometimes are guilty of trying to become their own utopian society. You know, we want everything under our federal ID number. And some things churches are not good at doing. And we probably waste resources sometimes when we try to be all things to all people. What I think the new church and the church of the future will be, it will always, and I think we have some areas where we should be the leaders. We should be the spiritual leaders. We should be the religious leaders. We should set the standards according to the teachings of the Bible and according to our denominations. But there are some areas where we ought to be happy to relinquish that leadership. We should be running to people like the Memphis Food Bank and saying, where can we help? Where can our people plug in when that truck backs up in Dyersburg, when that 18-wheeler comes in there, and at 5 in the morning, and we all go out and pack those boxes, and we help do the vouchers to make sure that people who are hungry don't get pushed out by people who are beating the system.
Absolutely. Yeah. You know, and there's one of the other core problems that we've touched on. We've talked about it a couple of times, and I want to make sure to hear from Mr. Kohlheim, because you started off, Pastor Luvene, talking about the health care. One of our core challenges is wages. So that's something that at another time, possibly in another program, we will talk about the need for a living wage as an employee and or a business owner. So we'll talk about that a little bit later. But what I would like to talk about more now is from Mr. Kohlheim and the healthcare perspective. Now, Pastor Kohlheim, you have seen people at ground zero, where you're going in as a healthcare professional. And what are just some of the opportunities or challenges that you've seen from the standpoint of visiting with and talking with these folks and serving that community?
I think one of the things that is so heartbreaking from just looking at your community, and it's not white, black, or anything, but you see the senior citizens, first of all, they feel like they're forgotten anyway, because as they get older, they're kind of pushed aside, so the younger generation does not spend as much time with them. But also, they have health challenges, and because they have not had the money to get the health care that they needed, they're struggling with diabetes, they're struggling with high blood pressure, they're struggling with all types of diseases and conditions, but they don't have the quality of care that they need to help their lives better. And it's not that it's so much money is required, but they don't have the basic needs. And that is so frustrating when you see it. You go time and time again, city to city, family to family, you see the same thing. And it's also that they've been in a way of eating for so long. You're trying to introduce fresh produce. You're trying to back them off the sodium. You don't need so much pork. You don't need so much fried chicken. It's like, baby, this is just what I eat. And so there's a tug of war where you're trying to move people who are really set in their ways and want to do things their way because they've been doing it for so long. So I was talking to Pastor Levene earlier. He said he's introducing a community guard, but then I would ask him also, sometimes people have the food in front of them and simply choose not to partake of it because it's just not what I want. We understand I need to do better, but I simply choose not to because I just want to eat what I've been eating, and I'm gonna be okay.
Go ahead.
And you see the frustration. Some people have got to the point, well, I just die when I die. And so you can't force anything upon them because they have to make a choice. Do you want to live a healthier life? And that's a question that you cannot force somebody to move in that direction. Either they want to live a healthier life, they want to be more of what God has created them to be, or they're simply going to just mark days off the calendar like they're in jail.
Yes.
And that's what you see, unfortunately, sometimes.
And that's the value of that educational component that you're providing.
And that's what we do, to make sure that they understand the benefits of eating healthy. And you do see some changes, and it's simple changes. You don't have to take away the flavor. You can use smoked turkey instead of that smoked pork.
I'll buy that.
You know, so and it's collaborating with different organizations. We collaborate with the extension services throughout Tennessee and Mississippi and Arkansas, so that when we're distributing food, they're there with healthy recipes and menus based on what we're providing to show them how to cook it in different ways and to make it healthy. And you know, I understand what you're saying about some people being set in their ways, but that's why we start early on our Feeding Children's program, not just providing food to children, but providing nutritious food in our backpack programs and at our kids' cafes, and explaining to the children why they need to eat healthy, showing them how to prepare healthy snacks so that they start early. And you'll be amazed how when children get it and they take it home to their parents, and many of these children are being raised by their grandparents, so they take that home. We will introduce them to fruit that they've never had before or vegetables, and then share them to take home to their families. So you don't throw your hands up and give up, but understand the importance of continuing to make a difference. And you talk about seniors. From our last hunger survey 4 years ago, we were serving 11% seniors. That number has increased to 29%. And many of these seniors are raising their grandchildren and don't have custody. So they don't have all the benefits that come with raising a child.
Wow. Well, thank you all very much, too. And Pastor Levene, I think that you've got some closing comments.
I do. Two things. One, and I'm glad you brought this up about the living wage, because there is a very strong and long connection between people's abilities to purchase health care. One of the reasons the Methodist Church and many other churches are very strongly in support of the Affordable Health Care Act is because of its name. You know, it's not Obamacare, it's the Affordable Health Care Act. And here's what I think sometimes people miss in this debate. The working poor, not the poor, but the working poor, is one of the largest segments in our country. Those are the people who work. See, there's this belief that people who don't have money or people that are poor are somehow lazy. No. The working poor makes up the bulk of our country. Those are the people who work in the McDonald's. Those are the people who clean up this beautiful Benjamin E. Hooks library. They work. These are people who have dignity. And the church should be, I believe, advocating for those, because that closes that gap. That means that people don't have to choose between eating and health insurance if they can afford to pay for their health insurance. So I want to just end with that and say thanks to each one of you for being a part of this project for me. We might have a follow-up on this once I get back from Nashville, but it is ways for our church, but the church universal, to partner and connect the dots, because we're not alone, and we are our brothers and sisters keepers. Thank you.